How is stomach lymphoma diagnosed? When it comes to diagnosing stomach lymphoma, a type of cancer that affects the lymphatic tissue in the stomach, the process is thorough and involves several steps. First, doctors conduct a clinical evaluation. They look for symptoms such as abdominal pain, nausea, weight loss, or gastrointestinal bleeding. These signs may raise suspicion for stomach lymphoma and prompt further investigation. One of the most important procedures in diagnosing this condition is an upper endoscopy, also known as esophagogastroduodenoscopy. During this procedure, a thin, flexible tube with a camera is inserted through the throat to visualize the stomach lining directly. This allows the doctor to see any abnormalities. Importantly, during the endoscopy, the doctor can take biopsy samples, which are small pieces of stomach tissue. This biopsy is crucial because it confirms the presence of lymphoma cells and helps determine the specific type and aggressiveness of the lymphoma. In addition to the biopsy, laboratory tests play a significant role in the diagnosis. Blood tests are performed to assess overall health and look for markers associated with lymphoma. For instance, elevated levels of lactate dehydrogenase may indicate a more aggressive form of the disease. These tests can also check for infections, such as Helicobacter pylori, which is linked to some gastric lymphomas. Once the biopsy confirms the presence of lymphoma, imaging studies are conducted to determine the extent of the disease. Computed tomography scans of the abdomen, pelvis, and chest can detect enlarged lymph nodes or organ involvement. These scans can also guide biopsy needles to suspicious areas if necessary. Another imaging test, positron emission tomography, is often combined with computed tomography. This test highlights metabolically active lymphoma cells, showing whether the cancer has spread beyond the stomach and helping assess how well treatment is working. In some cases, additional tests may be indicated. For example, if there is fluid accumulation in the chest or abdomen, fluid samples may be collected to check for lymphoma cells. Rarely, a lumbar puncture or spinal tap may be performed if there is concern about lymphoma spreading to the central nervous system. In summary, diagnosing stomach lymphoma relies primarily on an endoscopic biopsy, along with laboratory analysis of tissue samples and blood tests. Imaging studies further help to establish the extent of the disease. This comprehensive approach ensures an accurate diagnosis and guides appropriate treatment planning. If you have concerns about symptoms or risk factors, it is essential to consult a healthcare professional for personalized advice and evaluation.